Hello, I'm Dr. Mohan from the Medical College of Wisconsin. I'll be discussing our work on the use of a stem cell boost in patients who experience immune effector cell associated hematotoxicity or cytopenias, as we call, after BCMA directed CAR T therapy in multiple myeloma. So we know that immune effector cell associated hematotoxicity or ICATs or cytopenias are very common after CAR T cell therapy. This can result in significant morbidity. It can result in profound cytopenia, increasing the risk of infection, bleeding risk, increased utilization of healthcare resources such as growth factor support, transfusion requirements, and more importantly, it can result in financial and time toxicity for our patients. The delivery of anti-myeloma therapy in the post-CAR T cell relapse setting can also be challenging if the patients are cytopenic. So that's why ICATs is pretty important, and it's now recognized as one of the most common problem that we see following BCMA CAR T cell therapy. So in this study, we included patients who received BCMA CAR T cell therapy in the relapse setting, both on a clinical trial setting and real and standard of care, ide-cel or cilta-cel. So we included about 108 patients. This is again a heavily pretreated patient population with 90% of patients receiving a prior autologous stem cell transplant. The median line of therapy was about 6. So we note that cytopenias like neutropenia, anemia, and thrombocytopenia is pretty common 21 days post CAR T cell infusion. The numbers, the cell count actually recovers at the 3 and 6 month mark. However, even at the 6 month mark, roughly 6% of patients continues to be neutropenic. If you look at ICATs, which is cytopenias, either neutropenia, anemia, or thrombocytopenia, 60% of our patients have ICATs at day 21, that's 3 weeks after CAR T cell therapy. These numbers improve at 3 and 6 months, with roughly a third of the patient continuing to be cytopenic at that point. So we looked into the utilization of stem cell boost, which is stem cells that were collected and that were in storage in patients who develop cytopenias. In our study, nearly every patient who had cytopenia had stem cells in storage. So thus, and a third of the patients received stem cell boost about 116 days after CAR T cell therapy. We note that the cell count recovery post stem cell boost was durable and it was prompt. Interestingly, we also found in our study that cytopenias or ICATs 3 weeks after CAR T cell therapy was associated with a poor outcome. So overall, this study really establishes that we should keep in mind that cytopenias are pretty common after BCMA CAR T cell therapy, and perhaps we should be collecting upfront stem cells if CAR is planned in the future, either in earlier lines or in the lab setting. Thank you.